So I was wondering how successful we would be in shifting the energy, so to speak, from a long day of amazing and interesting information on evidence and research gaps and models that are going on today to education. But I think it's been a very nice transition. And we have now about 15 minutes if people have questions, comments, additions for our speakers. Anyone?
Judy Watt-Watson from Toronto.
Yeah.
Thank you for excellent presentations and the work, certainly Scott and Dan Carr, that's being done. Just one little thing, and that is, I think the center of interprofessional education is the patient. Mm-hmm. And hopefully that we're not going to forget that. Mm-hmm. Just an interesting comment, when I did my doctoral work, I was looking at using empathy with health professionals. Mm-hmm. And one presentation, I had a colleague from another profession than mine say, "What on earth are you doing? Don't you know that nobody cares about empathy?" Anyway, just a little thing. Let's remember the patient.
Yeah. Please.
Monica Gross from the POISE Project, Alexander Technique for Pain Management Initiative, but I just wanted to bring up something that hasn't come up, which is, what about when the medical or allied health professional is the patient? Mm-hmm. In other words, so many, that was, I hope, not occupationally related, but there are so many medical and allied health professionals who suffer occupational ills, particularly chronic, that can lead to chronic pain and can lead to addiction themselves. So one way of addressing education for medical and allied health professionals is giving them the somatic information that they need and the self-care strategies they need to take care of themselves. This empathy for themselves and this building up of their own resilience will be one of the best ways of them then being able to offer appropriate pain management strategies and treatments for their patients. Just one example is that the stats for dental professionals, dentists, 87% of dentists suffer from chronic pain. 96% of dental hygienists suffer from chronic pain. And one of my colleagues, Dr. Ani Kobal in Australia, she was a dental professional who had chronic pain, occupational, and she started a program to go back to train her colleagues in, it's Alexander Technique based, but to train them in optimal postural health, and then to go into the training programs at the universities to deliver it. So I think that's one also part of the puzzle of helping the patient when the doctor can understand their own well-being.
I think that, thank you so much. I think that many of us, either ourselves or family members or beloved ones or colleagues, we have probably assisted them in putting together their own team to deal with many healthcare issues and medical issues. These days, one wants to certainly walk in with what I would call a medical advocate. And I think that in that sense, we all probably have some kind of a personal experience in this area. And they're now actually talking about the quadruple aim. I think some of you have heard about that. So not just the issue of better patient outcomes, reduced costs, and patient satisfaction, but the whole issue of self-care. There are actually excellent studies now showing that about 52% of most health professionals have too many signs of burnout. And I think we could go on for another several days in this entire area. I would refer you to the last Global Forum for Innovation in Health Professional Education, our workshop in April of this year, focused very specifically on health and well-being. And I think for all of us in this room, that could be very beneficial. So it's also really looking at prevention what can we all do? And someone mentioned preschool. I think that's an excellent idea. Is what can we all do, particularly in our culture of do more, do it faster? What can we all do to be sure to take care of ourselves, to have a better work-life balance, and to, as much as we can, avoid some of these difficult chronic pain issues? But when they occur, aren't we fortunate that we have so many health professionals and techniques to access here in this country, north of us, in Europe, really throughout the world? There's some amazing treatments out there now. Other comments, other additions, questions for our speakers? I know it's getting a little late in the day. Please, and also anyone at the panel. Yes. Yeah,
that was a really good idea, I think, of looking at that story. I was at a sickle cell meeting last summer. It's terrible condition. It's where racism and ignorance collide in the medical field. And we made a module on that, based on that story. And Shiree just came out, and it's really good. And it's a woman, it's a 21-year-old, who tells her story. And at the end, she said, "This is real. I'm sharing this so that you understand." And I think that sounds like a good story, too. So maybe in 6 months, I'll be at some other conference telling about our new module on that.
And can I just comment? I'm sorry. Can I comment briefly? Also, I know that I've worked with several dental hygiene schools trying to help them to educate their practitioners before they go out into the field. So I know this is an area that health professionals are concerned about. I know in OT we do the same thing. Physical therapy, there is focus on training the therapists to do it well and to be aware of their own health. But people never believe they're going to get injured. I mean, it's very hard it's very hard to get people to take things like this seriously when they don't believe that they're going to wind up with to be that person with chronic pain, because they're young, many of them, and they just don't see it as happening. So you're absolutely right. We need to be able to educate our practitioners in this area to give them empathy, and train them to do it well. But it is a challenging area to work in.
And I just add that, in our primary care pain fellowship, and again, I want to emphasize it's for the primary care team, we spend a lot of time on wellness, or this idea of prehabilitation, that if you're not fit intellectually, spiritually, psychologically, physically, to deal with your patients, you're much more likely to not like them and not want to treat them.
Good point, please.
Kim Dunleavy. Dr. Fishman, the competencies that are now out, have you had any of that implemented into the medical school curriculum, and the competencies that are now sort of being pushed out as far as the examinations for the entry level?
There are medical schools that have used the competencies to guide educational reform for medical schools. It's too new to know what's happened on the other side of that. The National Board of Medical Examiners took our report. I don't know if you're like me, but I assumed the National Board of Medical Examiners was a public organization. It's actually a private company, and it's a proprietary process. And I do believe that they took it very seriously, and I think that the test will change. But I think the most important thing is to get our accreditors if you've ever been through a health professional accreditation, that's the only time we clean the carpets and we bring out food we've never seen before. And that will change. That will change education very quickly.
And
so we haven't seen that yet.
Practical exams as well as written?
Again, I don't know, but it's out there to guide that.
Thank you.
Okay, time for one more.
Yes, John Shea from Case Western Reserve and Metro Health System. So this is for Dr. Fishman. So as a pain medicine fellowship director, can you comment a little bit on your thoughts at that higher level of medical specialties who are being trained as fellows and specializing, things we learned today that are outside of a typical pain medicine fellowship program, beyond the injections and the procedures and so on. So what is your thoughts on the integration of some of what we're talking about today into that training program?
Well, I think I just started, and I won't go, I could probably talk for an hour on that subject. But there are groups now looking at that, as you may know, at the American Board of Medical Specialties. But the bottom line is that it's, we teach individuals to become, and particularly physicians, to become pain specialists. But there are other groups that are becoming pain specialists as well. And even those individuals have to understand it's a team sport. We have problems when we do it in isolation and we start to believe our own thoughts. We don't ventilate these thoughts across the silos. So that would be my admonition to our fellowship directors, of which I was one many years ago, that we tend to be siloed and tunnel visioned, and again, as a field, we're accused of either being, pill mills or block shops. And, we like to say we're conscientious injectors at the end of the day. I'll leave it at that.
On that note, Tony?
Tony Toledo, University of Pittsburgh. A thought just occurred to me that it seems like an easy thing to do would be to define the curriculum, define the competencies. I mean, I know that I don't want to minimize what you've done, but from an implementation standpoint, rather than roll these out or try to roll them out to the different educational institutions, roll them out to the accrediting bodies and say, this is what we all think should be the educational component, and the schools will follow. Guaranteed they'll follow.
Amen.
But the accrediting bodies don't usually dictate curriculum is the thing. They'll dictate like a generalized goal. Like if we talk about LCME, they'll say you should have education in this area, but they won't list competencies. That's part of the challenge. I mean, it's a good part of the strategy.
But if I can just say, this is what I probably didn't articulate clearly enough, that if you've seen one curriculum, you've seen one curriculum. Everyone's going to reach that competency in a different way. Mm-hmm. But if the accreditors require that the school substantiates that they're graduating competent students because they've reached the goals, they've demonstrated those goals, that is the step that we need to take, and each school will absolutely do it differently, which is probably great.
So thank you very much again, our speakers and discussants. Yeah.